Suganya is giving a lot of berries. Yes. Please type in where are you from. Please like before session. Tabitha Parvez is saying please click the like button before the session. Yes, sure. Right. See only out of 105 only 12 people have clicked like button. I don't think even those people in the Zoom have clicked the like button. Yes. Okay, let's have a minute silent prayer. Amen. So once again, good evening. Welcome to EduSkills OET made easy. Our mission is to make you fall in love with OET. And if you're watching on YouTube, kindly consider subscribing the channel and give us a thumbs up if you like this mission, and share to your contacts so that we reach out to maximum number of OET aspirants, especially those who are financially struggling to crack OET. EduSkills is a free platform. We don't charge for any of our services. Let's empower each other and grow together is the tagline. And this platform is of the health professionals, by the health professionals, and for the health professionals. That we are able to render free service. And today we are going to look into listening part B on special demand from the new batch. And, we'll be learning some more special tricks today. Let's see, I'll be sharing my screen. Let me know if you can see my screen. Share some of this. At YouTube, please let me know if you can see my screen and if I'm audible. Hi from UK, yes. Shani Chandi, hi. Sunaina Aurora, hi. Good evening. Aparna, yes. Ashwarya Hariharan. Says everyone, please like the video. Yes, like the session. Click the like button. Share to your contacts, some of the WhatsApp groups, so that we reach out to maximum number of people who are really struggling. Hi, Father, may I ask you a question? Joanna, yes, I have enrolled under EM6 and done the tasks accordingly. However, I noticed the task sequence that are posted by the students on the platform are different. Oh, I don't think there is maybe you have a confusion. Probably you missed somewhere in between. You can just message this at the Telegram chat to Sabri Lakshmi or Shanmuga or Nidhi, the batch in charges. They will answer you, okay? I think maybe you confused it. Maybe you missed one or two tasks. It's cool. Yes. Let me know whether I'm audible and the screen is visible to you at YouTube. Give me a thumbs up if everything is fine. We'll rock in. Yes, yes, yes. Yes. Please click that like button and share the video to your contacts. Okay, today we are going to deal with listening sample 3 from official OET website. Thank you, OET, for allowing me to use this for teaching purpose. And OET listening skills, we'll be dealing with listening part B, key skills. And always remember when you do part A, you have to think fast, go fast wherever. But as you move on to B, cool down, okay? Cool down, relax, and get into the details, which I am going to teach you now. In this part of the test, you will hear 6 different extracts. In each extract, you will hear people talking in a different healthcare setting. That's very, very important. keep a diary of healthcare settings and the tasks being asked in each setting. Okay, so keep a diary of healthcare settings. That will really help you. Need not to copy from somewhere, but as you practice, take from each extract what is the setting and what is the task asked. And for questions 25 to 30, choose the answer A, B, or C, which is fits best, not the good or the better one, the best fit answer. According to what you hear, not according to your knowledge, not according to your medical knowledge, according to what you hear, the best answer according to the audio. You will have time to read each question before you listen. Those are the golden seconds where you have to identify the hedging words. At the YouTube comment space, there was some concern asked how to identify the hedging words. We'll find it out today. Complete your answers as you listen. Okay. You will have 90 golden seconds, all those things. See, this is how you have to create a diary. For example, today's healthcare settings. First one is dental receptionist. Means a patient has come to the hospital and conversing with the receptionist in the dental segment, department. Okay, so you know what he'll be asking. Definitely, what will be asking? Just type in a patient who has got some problem with the tooth has come to the receptionist in a dental hospital, dental department, and he is conversing with the receptionist in the hospital. What will he be asking? Type in a chat, and those at the Zoom can tell me if you can tell me something. What will just presume, foreseeing? We said in the FILST method, first thing is foresee. Yes, tooth problem. Okay, appointment, definitely appointment. Yes, yes, YouTube setting. Yeah, inquiry about the availability of doctor, procedure, appointment, toothache. Okay. Treatment. The task asked is what is the feeling expressed by the patient? Okay. The feeling of the patient is the task. And second one, that is 26, question 26, presentation to nursing staff. There is a presentation to nursing staff. That is the healthcare setting. And extension to visiting hours. The visiting hours are extended. So that is the setting, healthcare setting is, there is a presentation to the nursing staff. The concept is, or the topic is, extension of visiting hours. And task asked is task of the speaker. What does the speaker want to convince or say? Third setting is recovery ward, surgeon discussing a patient with a nurse. Surgeon, nurse discussion about a patient. That is a healthcare setting. And what is the surgeon concerned about? You have to listen for the concern of the surgeon. Then you have chiropractor briefing about a patient named Ryan. And task is aim of the treatment plan. What is the aim of the treatment plan? You have to just listen to what is the aim of the treatment plan. And fifth question, the healthcare setting is surgeon talking to a group of medical students. That is the healthcare setting. What will we be discussing with them? Patient risk. The concept is patient risk. Fact emphasized. What does the surgeon emphasize to the medical students? What is given the emphasis? That is the question you have to listen to answer, you have to look for. Then the last one is surgeon talking to a patient. Surgeon, patient, discussion about knee operation and what is patient's feeling. You have to listen for patient's feeling. What does the patient, how does the patient feel? See the beauty of this. This you have to be very particular. These are the things you have to do during those golden seconds when you are given time to read. So let's check out question number 25. Okay, listen now. Okay, after that we'll identify the hedging words, or we'll go for the hedging words first. Come on now, let me know what are the hedging words in question stem. This part of the question is known as question stem. You hear a patient talking to a dental receptionist. How does he feel? That is the question stem and other three answer options. So what is, you can type in and those who are here can shout out, no problem. What are the hedging words?
Dental receptionist.
Yeah, dental receptionist is the setting which you have to concentrate. Sorry.
How feel? Feel.
Yeah.
You feel.
Yeah. Yeah. How does he feel? The patient. How does the patient feel? So the feeling of the patient is important.
ಡೋರ್ ಮುಚ್ಚಡಿ ಓಪನ್ ಮಾಡಿಬಿಟ್ಟು ಹೋಗಿದ್ದಾಳೆ.
Yeah. Sorry. I didn't get you. It's cool. Option A, worried that he may have damaged a filling.
Yes.
Worried.
Worried. Okay.
Worried.
He is worried.
Disappointed.
Then disappointed that he can't be seen immediately.
Nervous.
Nervous about, yes. Nervous about treated by a different dentist. Nervous about being treated by a different dentist. So you have to find out whether he is worried about something. Is he disappointed that he is not able to meet doctor immediately? Doctor is not available. Or is he nervous about being treated by a different dentist than his own dentist? Okay, family dentist. Okay, listen now. And write down the answers in your notebook. Listen and write down, read.
Hi, I'd like an urgent appointment, please.
Let's see, who's your usual dentist?
Mr. Garcia?
You say it's urgent. Are you in pain?
Yeah, it's the tooth Mr. Garcia filled last week.
Well, he's away today, I'm afraid, but there's a free slot this afternoon with his colleague, Mrs. Brown.
Well, that'd be okay, but are you saying Mr. Garcia could fit me in tomorrow?
That's right, we'd get you in first thing. Can you wait?
Well, I'm not chewing on that side and I'm taking paracetamol, which is helping. The pain started when I was eating a steak, so I'm frightened I might have upset Mr. Garcia's work. It makes sense for him to check it out.
OK, we'll book you in for tomorrow morning at 10.
Yes, some say disappointed, some answers say worried.
Question 26.
Nervous. Sorry.
You hear?
Yeah, then there are different answers. Worried, disappointed, nervous, worried. And I'll tell you one of the most challenging segment is this, what I'm dealing today. I'll be teaching you. That's why I said you have to focus on the setting. Maybe out of those things we have done so far, this is the most challenging one. Sample 3, part B. So please type in your answers. A, C, C, A, B, B. Okay. You know, last time everybody was typing in the right answer. Now there are different answers. A, B, C, all the answers seem to be right. Okay. Check out. Okay, cool. Now we will do one thing. We will go into the, what you call, script and this one. Then we'll find out, okay? Listen, read, and write. Write down the important points or the answers, whatever. You have to do the multitasking, practice it, okay? I'm going to play it once again. Now look at the question 25. You hear a patient talking to a dental receptionist. Now read the question, and from here, hi, I'd like to, like this.
Hi, I'd like an urgent appointment, please.
Let's see, who's your usual dentist?
Mr. Garcia?
You say it's urgent. Are you in pain?
Yeah, it's the tooth Mr. Garcia filled last week.
Well, he's away today, I'm afraid, but there's a free slot this afternoon with his colleague, Mrs. Brown.
Well, that'd be okay, but are you saying Mr. Garcia could fit me in tomorrow?
That's right, we'd get you in first thing. Can you wait?
Well, I'm not chewing on that side and I'm taking paracetamol, which is helping. The pain started when I was eating a steak, so I'm frightened I might have upset Mr. Garcia's work. It makes sense for him to check it out.
OK, we'll book you in for tomorrow morning at 10.
Okay, now do you change your answer?
Question 26. You hear part.
Do you want to change your answers? So answer is, he is worried that he may have damaged a filling. How did you get into that answer? Yes?
Upset father.
Pardon? Still there are different answers coming in. A, B, B, C. Okay, now you see. Second option, disappointed that he can't be seen immediately. So he doesn't say, he doesn't express any disappointment here. See, he says it's cool. I can meet him. I can have an appointment tomorrow. Okay. Now, nervous about being treated by a different dentist. He says, Now you say, well, he is heavy today, I'm afraid, but there is a free slot this afternoon with his colleague, Mr. Brown. That would be okay. He says that would be okay, which means he is not nervous about it. She says he is nervous about being treated by a different dentist, but he is not nervous. He says it's cool, it's okay, right? But then he says, but are you saying Mr. Gupta could fit me in tomorrow? Will it be possible that I can meet my own doctor, Gupta? Okay? Are you getting it?
Yes, Father.
Okay. So he is
Yes,
not
Father.
disappointed. He is not disappointed. He is hopeful. He says, see, that's right. We will get you in first thing. Means tomorrow we'll give you the first appointment. Can you wait? Then he says, well, I am not chewing on that side and I am taking paracetamol, which is helping. Means I am cool. I can wait. No issues. So he's not disappointed. He says, I am happy to wait. I am happy to wait. Got it? He is not disappointed that he is not able to see him immediately. He said, I can wait because I am taking paracetamol and that helps me and I am not chewing with that side. So it's cool. He himself opts to meet tomorrow. So nowhere it is said he is disappointed that he can't be seen immediately. What does he feel? Disappointed that he can't be seen immediately. There is also some grammatical mistake. It's a second option that I don't want to tax you with those details now. Worried that he may have damaged a filling. You see, you say it's urgent. Are you in pain? What is his concern? It's the tooth Mr. Gracia filled last week. Okay. Fill means filling is here.
Feeling.
And I am frightened, worried. I am frightened. I might have upset Mr. Gracia's work. Means he may have damaged filling. What is Gracia's work? Mr. Gracia filled last week. Is the tooth Mr. Gracia filled last week. I am frightened I might have upset Mr. Gracia's work. Means Gracia's work means filling. Is that cool?
Yes,
Correct,
Father.
correct. Yes. Upset. Yes. Yeah, upset. Yeah, somebody is upset. Somebody is mentioning upset. Do you have upset here? Nowhere. Okay, Suganya, I didn't understand. Yes, cool. Shall we proceed?
Yes, Father.
Question number 26.
Father.
Type in yes and a smile. I don't see energy even at Zoom. Nija Kuriakos will have to have a cup of tea so that you can have a smile. Please. Okay. Right. At YouTube, yes, we are going to question number 26. Okay. Now, let me know what are the hedging words. You hear a part of the presentation to nursing staff about an extension to visiting hours. What is the speaker doing?
Visiting hours. Extension to visiting
Extension
hours.
to visiting hours.
Extension to visiting hours is the concept. Okay. Presentation to a nursing staff. What is the speaker
What is the
doing?
speaker
task
doing?
of
Speaker
the-
doing.
Yeah, that is the task of the speaker. What is the task of the speaker is being asked here. Detailing the benefits of the plan, benefits, then reassuring them that the workload won't increase. Yeah, workload,
Reassuring.
reassuring workload, okay. Then explaining steps they should take to avoid problems. Explaining steps, okay. They should take to avoid problems. So avoid problems. This could be something else. Explaining steps. Okay, task-based hedging words, reassuring, and detailing. These are the differentiating hedging words, and these benefits workload and avoid problems are the concept-based hedging words. Hedging words means keywords. Detailing, reassuring, explaining steps is the differentiating hedging words, whereas benefits, workload, and avoid problems are known as concept-based hedging words. Cool. That's clear. So now listen and try to find out the answer. It's going to be easy.
Now, you'll have received the survey asking your opinion about extending visiting hours, and doubtless you've got your own ideas about the possible impact on your work. You're probably aware of the evidence pointing to the positive effects on patient recovery rates of increased contact with loved ones. This isn't in question, but of course things must be managed properly. I've heard concerns about how busy everyone is, that you've got enough on your plates without having to worry about extra demands from visitors. Well, we've carefully planned things to prevent you being overrun with queries, interruptions and so on. Visitors will be given a list of do's and don'ts outlining what's expected of them. Meanwhile, managers will be monitoring things carefully to make sure routines aren't disrupted at all.
Yes.
Question
Type in what is the answer.
27.
What is the answer?
You hear a surgeon discussing
What's the answer? A or B or C? Come on at YouTube. Yes, B, C, B, C. Yes, Father. Bina Thompson, I'm asking for the answer. You're saying yes, Father. Yeah, B, C, C. There are some C's. Okay, let's go to the so which is answer? Reassuring them that their workload won't increase. Let's check since there are doubts. Let's check with the script, okay?
Now, you'll have received the survey asking your opinion about extending visiting hours, and doubtless you've got your own ideas about the possible impact on your work. You're probably aware of the evidence pointing to the positive effects on patient recovery rates of increased contact with loved ones. This isn't in question, but of course things must be managed properly. I've heard concerns about how busy everyone is, that you've got enough on your plates without having to worry about extra demands from visitors. Well, we've carefully planned things to prevent you being overrun with queries, interruptions and so on. Visitors will be given a list of do's and don'ts outlining what's expected of them. Meanwhile, managers will be monitoring things carefully to make sure routines aren't disrupted at all.
See? And you know, if there are, if there is a contrast word, answer must be?
After the contrast word.
After the contrast.
After the contrast word. So here there is a contrast word. So normally answer must be after that. So here part of a presentation to nursing staff about an extension to visiting hours. Okay, that is the concept. You see, now you will have received the survey asking your opinion about extending visiting hours, and doubtless you have got your own ideas about the possible impact on your work. Possible impact on the work. That is a controlling idea. What is the impact on the first one is the topic sentence. The first sentence is the topic sentence. The concept is extending visiting hours. And the controlling idea is impact on the work of nursing staff. You are probably aware of the evidence pointing, okay, this isn't in question, but see, this is it in question. Which one is not in question? Positive effects. Positive effects are not in question. See now here, positive effects are not in question. Okay. See, detailing the benefits of the planned change. That is not the concern. That's not in question. Benefits means positive effects, right? So you can eliminate option. That's not the concern, they say. On patient recovery rates of the increase, that this is not the questions. Okay, this is not the question, he says. That's not our concern. But after the contrast word, but you have the answer. What is the answer? But of course, things must be managed properly. I have heard concerns about how busy everyone is. How busy everyone is. Nursing staff, they feel they're terribly busy. And now if you extend the visiting hours, again, they will have to be concerned about the visitors now. Additional load. That you have got enough on your plates means you have enough work. You have got enough on your plates means you have hectic schedule, lot of work. Okay, that's a beautiful expression you can learn to speak, use in your conversation. Okay, that you have got enough on your plates. You can say, I have got enough on my plate, means I have enough work, don't give me extra work. Don't give me task tomorrow. Okay, I'm hectically scheduled. Well, we have carefully planned and see, without having to worry about extra demands, from the visitors. You need not worry about extra demand from the visitors, extra works from the visitors. Well, we have carefully planned things to prevent you being overrun with queries, interruptions, and so on. Workload. Okay? Workload won't increase. Overrun, we have carefully planned things to prevent you being overrun with queries, interruptions, and so on. Means your workload. Do they explain any steps here? Third option, explaining steps they should take to avoid problems. No steps at all. No steps are mentioned at all. Okay. So that's also eliminated. So what is the answer? B.
B, reassuring.
Hope that is clear.
Yes,
Yeah.
Father.
Yes,
Yeah.
Father.
Cool. Let's go to the next question. Okay, let me know what are the hedging words. Question number 27. You hear a surgeon discussing a patient with a nurse in the recovery ward. What is the surgeon concerned about? What are the hedging words?
Recovery ward.
Incomplete.
Okay.
Recovery ward.
The recovery
Surgeon
ward is,
concerned.
yeah, recovery ward is
Surgeon
very, very
concerned.
important. What is the surgeon
Surgeon
concerned
concerned.
about?
Concerned.
Concerned about. Okay, surgeon discussing a patient with a nurse. Surgeon, nurse discussion. Okay, next, option A.
Lab test.
Okay, lab test.
Side
Side
effects.
effects.
Side effects.
Level of
Level of
consciousness.
consciousness.
Level of consciousness. From your general knowledge, let me know. Recovery ward. See, the patient is in the recovery ward. You know what's the recovery ward, right?
Yes.
Yes,
Will
Father.
the surgeon
Yes, Father.
discuss about lab tests and their results and incomplete results?
No.
No,
No,
Father.
Father.
Those things will be confirmed before that surgery, right?
Yeah.
Yeah.
Yes,
So
Father.
incomplete results will not be discussed here at all. The patient's level of consciousness,
No,
do
Father.
they bring to the recovery ward without having proper consciousness, reaching the proper consciousness?
No.
No.
I don't know. You'll have to say. I'm not a
No.
medical professional. Normally, the patients in the recovery ward are conscious, right?
Yes, Father.
Yes.
Normally.
Yes.
Okay. So, lab test cannot be discussed here in the recovery ward. And normally, this also will not be discussed. Then why should you go to the audio? Tell the examiners, please skip the audio and go to the next audio. Then we
Wow.
can have our lunch early. Okay. Let's check. Okay. Listen now. Listen for the side effects. If there are many side effects mentioned, try to write down. Okay. This multitasking practice. Try to write down on your notebook. If they mention a lab test, write down lab test. If they mention side effects, mention side effects and type in. If you have two instruments at your side, type in the chat box or comment space. And also, if they speak anything about level of consciousness, you can think of. But otherwise, you can think about the lab tests and the side effects, listen and write down. Maybe you can make 2 columns. Results of lab tests one side, other one side effects. Let's see which one will be filled. Okay, cool. Listen now.
It looks like Mrs. Jones is still a bit groggy after her thyroidectomy. Will she be going up to the ward soon?
Yes, I'm going to call a porter. She should be going up in 15 minutes.
Okay. I've added some extra post-op pathology orders. She may have problems with the drop in her calcium. Her thyroid was just huge. We didn't see all 4 parathyroid glands, and we need to check that they haven't been affected by the procedure. She seems okay, but I want her calcium level checked twice a day. She needs to be monitored for any breathing problems, muscle cramping and numbness, and for tingling in her fingers.
Okay, I'll make sure a report to watch out for hypocalcemia is passed on.
Okay, if you need me, call me.
Okay, did you find what did you find? Results of lab tests or side effects? Which column was filled?
Calcium level.
Yeah, calcium level.
Side effect. Breathing
Yeah,
problems.
calcium level.
Muscle problem.
Muscle cramps.
Parathyroid,
Less drink.
cramping, numbs. Yeah, Ashwari, Hariharan had put so many. Yeah, great. Yes. All these are side effects. Continuously they are explaining side effects. Then the question is, what is his concern? Not one side effect, multiple side effects. Nothing else is mentioned in the audio. How easy, how sweet, how nice. Enjoy. Okay, listen now with the script so that you are sure. Yes. With the script. Yes.
It looks like Mrs. Jones is still a bit groggy after her thyroidectomy. Will she be going up to the ward soon?
Yes, I'm going to call a porter. She should be going up in 15 minutes.
Okay. I've added some extra post-op pathology orders. She may have problems with the drop in her calcium. Her thyroid was just huge. We didn't see all 4 parathyroid glands, and we need to check that they haven't been affected by the procedure. She seems okay, but I want her calcium level checked twice a day. She needs to be monitored for any breathing problems, muscle cramping and numbness, and for tingling in her fingers.
Okay, I'll make sure a report to watch out for hypocalcemia is passed on.
Okay, if you need me, call me.
Okay. So that's clear, right? What is the answer?
B, father.
Okay, B. No doubts. Even without listening to the audio, we could take that as the answer. Okay, B is the answer. I'm stressing it because some people ask in the comment space, which is the answer, they get doubts. Cool, B is the answer. So shall we go on to 28?
Yes, father.
Yes, yeah.
Father.
On now. Yeah, what is the hedging word? You hear a chiropractor briefing a colleague about a patient called Ryan. What is the overall aim of the treatment plan? Question STEM.
Briefing.
Yeah. Briefing a colleague
surgery. Can you break?
Overall aim.
Overall aim.
Aim of the treatment.
about the
Aim
patient.
of the treatment.
Treatment plan.
Treatment plan.
Aim of the
Yeah,
treatment plan.
aim of the treatment plan. Okay. What is the aim of the treatment plan? And improving pain relief.
Pain
Pain
relief.
relief. Restoring.
Okay.
Restoring
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 feelings.
feelings. Yeah, restoring feelings. Okay, feelings.
Treating side effects.
treating the
Treating
side
the
effects.
side effects.
Side effects.
Treating
Side
side
effects.
effects. Okay. Now listen, okay? See whether it is feelings. Okay, what is the aim of the treatment plan? Main aim. Okay, overall aim, not a single aim, overall aim. Is it pain relief? Okay. And restoring feelings in his arm, or treating the side effects of an operation. You know, if you remember, I have told you the first one is a particular one, second one is a particular one, third one is generic one. Side effects can include pain relief and numbness, all those things, right? If there are particular ones and one generic one will be the answer. If there are 2 generic ones and 1 particular, then particular one will be the answer. Do you understand? Overall
Explain
aim of
more
the treatment.
further.
See, they are asking for the overall. I have explained this several times. They are asking for the overall aim of the treatment plan. not particular partial aims, overall aim of the treatment plan. Pain could be one of the side effects, right? One side effect. Numbness, restoring feelings in his arm means there is some numbness, cannot feel. So numbness could be one side effect. Option A, one side effect. Option B, one side effect. Option C, many side effects. So option C is known as generic, means a collective one. Option A and B, singular ones. When there are two singular and one collective, collective will be the right answer. If there are two collectives and one singular, most often the one singular one is the right answer. Did you get me?
Yes, Father.
Yes, Father.
Yeah. So this is another strategy which I have several times explained to you. And look into these things. That's why I said you have to spend time analyzing the question. So what I'm telling you, pain relief, pain could be one of the effects of side effects. Okay? Which is considered in the treatment plan. The numbness could be option B, numbness, having no feelings in his arm, could be one side effect. But overall aim of the treatment plan cannot be treating one side effect. It should be treating all the side effects, right? Overall aim of the treatment plan. Overall.
Yes, Father.
Full.
Plural.
So what could be the answer?
C.
E may be the answer.
Plural form. Side effects.
Father.
I don't know. You listen and verify, okay? Listen now.
Today we're going to start with Ryan. He's 2 weeks post-surgery for a torn rotator cuff. He also had a spur on his acromion process removed. This is his first time in rehab post-surgery, I believe.
That's correct.
Okay, so today we're going to begin utilizing high-frequency vibration to break up the scar tissue forming in his left shoulder joint following the surgery. We're going to do each of his treatments that way, so you'll see a progression over time, how we get him back to a point where he's able to live his normal life. Movement's the key to rehabilitation, and this treatment resonates with the nerves too, so it should eventually help them heal quicker and reduce his discomfort.
Question 29.
What is the answer?
You hear a surgeon.
What is the answer?
C.
See,
Father.
this discomfort and
Sure?
yes.
Yes. That is the generic one, the general one, the collective one, I said. And if you know the strategies, you need not even listen to the audio. If you are allowed to take some snacks during exam, you can eat those chocolates. Select the answer, because in reading you can run fast. Here you cannot run fast. You have to wait. Look around and enjoy how others are struggling. Okay. There are so many questions of this type. I have explained a couple of them earlier as well. Just check out. Okay. So let's go with the. So this is the answer. Treating side effects of an operation. Let's go with the script and audio. Listen once again. Okay.
Today we're going to start with Ryan. He's 2 weeks post-surgery for a torn rotator cuff. He also had a spur on his acromion process removed. This is his first time in rehab post-surgery, I believe.
That's correct.
Okay, so today we're going to begin utilizing high-frequency vibration to break up the scar tissue forming in his left shoulder joint following the surgery. We're going to do each of his treatments that way, so you'll see a progression over time, how we get him back to a point where he's able to live his normal life. Movement's the key to rehabilitation, and this treatment resonates with the nerves too, so it should eventually help them heal quicker and reduce his discomfort.
See? in rehab post-surgery. The patient is in the rehab post-surgery. So aim of the treatment plan cannot be just pain relief, then you will have to give only painkillers, right? Overall aim of your treatment plan can never be just improving pain relief. That can be done only with painkillers. What about the other side effects? Restoring feelings in his arm, not only in his arm, in his brain, in his leg, in his shoulders, wherever you have some problems, that will be restored. That's part of the story. But the real story is treating the side effects of an operation. In the post-surgery rehabilitation, treating the side effects of an operation. Is that clear? Come on with a smile.
Yes, Father.
Yes, Father.
Yes, Father.
Yes, cool. Now let's go 29. You hear a surgeon talking to a group of medical students about patient risk in emergency surgery. This surgeon is emphasizing the fact that, what are the heading words in this
Surgeon
question
talking.
stem? Yeah,
Emergency.
surgeon talking to a group of
Surgeon
medical
talking to a
students.
group of medical students.
Yeah, about patient risk. About patient risk. The concept is patient risk. And the surgeon is emphasizing. What is the fact being emphasized by the surgeon?
Ensuring.
What does it emphasize? Where does he say this is important?
Important.
Where does he say this is important? And they will stress in the audio as if they are hitting your ears. Come on, this is important. That's what they are emphasizing. Option A, prompt preparation is the most effective way to minimize the patient risk.
Minimize.
Minimize patient risk.
Patient risk.
Prompt
Patient
preparation.
risk is the common concept. Patient risk is a common concept.
Most effective way.
Minimize
preparation.
Prompt preparation.
Prompt preparation. Most effective, you can highlight.
Most effective.
Okay. What is most effective then?
Certain types of
Certain
surgery.
types of
Certain
surgery.
Yes,
types.
more
Surgery.
More
risk.
risk.
More risk. Then
Extra recovery
time.
extra
Recovery
recovery time. Okay. Okay. Now, one strategy I told you, what is this most?
Scale, Father.
Yeah. If there is a scale, that could be the right answer. If you know the strategies that I taught you. Most effective. Let's check. We are not sure. We'll check. Okay. Listen. Which is the right answer?
If you look at the risks of elective surgery, they're really very low compared to emergencies. Clearly, then, we can make the biggest difference in reducing risk and improving outcomes in emergency surgery. Our mortality outcomes here are actually below average. We're at 8% compared to around 13% nationally. The emergency patients I handle tend to be older, so they're at higher risk. And when they come in, we haven't got long to prepare them in order to reduce any risks, maybe an hour or two. In terms of patient safety, every minute, every half hour we can use to get them ready counts. That's because the patients we're thinking about are prone to developing post-operative complications, given that they have a range of associated heart, kidney, and lung problems.
Yes. Prompt preparation.
Question
more
30.
risk.
You hear a surgeon talking.
Yes.
Option A, Father. Yeah, Father.
Option A.
Yeah, Father.
Okay. Prompt preparation is the most effective way to minimize patient risk. Just check out how they emphasize. Okay. Listen and write down.
If you look at the risks of elective surgery, they're really very low compared to emergencies. Clearly, then, we can make the biggest difference in reducing risk and improving outcomes in emergency surgery. Our mortality outcomes here are actually below average. We're at 8% compared to around 13% nationally. The emergency patients I handle tend to be older, so they're at higher risk. And when they come in, We haven't got long to prepare them in order to reduce any risks, maybe an hour or two. In terms of patient safety, every minute, every half hour we can use to get them ready counts. That's because the patients we're thinking about are prone to developing post-operative complications, given that they have a range of associated heart, kidney, and lung problems.
Okay, see now?
If you look at the risks of
See now? Prompt preparation. The prompt preparation is the most effective way to minimize patient risk. In terms of patient safety, every minute, prompt preparation, every minute, every half hour, we can use to get them ready counts. Get them ready counts. Prompt preparation, every minute. The stress is very much there, every minute. In terms of patient safety is that concept we set. Every minute, every half hour we can use to get them ready counts. That's very, very, very important, most important. Is that cool?
Yes, Father.
Yes, Father.
Yes, yes. So I said if there is a scale, that could be the right answer, and that was the right answer. And next, let's check the hedging words, the last question. Smile, if you have energy to smile. Yes. Cool. Anjali has lost the energy, yes. Yeah. Come on. Sorry, you hear a surgeon talking to a patient who has just had a knee operation. The man's comments reveal that he is. So, what are the hedging words?
Surgeon
Talking to a
Surgeon
patient.
talking to a patient and knee
Man's
operation.
Knee operation.
Comments.
Yes.
Man's
And
comments.
his comments
His-
reveal that his feelings, right?
His
Yeah. Option A, determined to
Determine-
start doing sports as quickly as possible.
Determine
Doing sports.
doing
Doing
sports.
Impressed how little time is spent.
Spend
Little time
time.
is spent in the hospital. Then that will be relatively pain-free. Pain-free soon. Okay. Other one is determined.
Determined, impressed, surprised.
Yeah.
Surprised.
Determined,
Surprised.
impressed,
Surprised.
and surprised. Yeah. Those are the differentiating hedging words. When they speak about feelings, the first question also was about feeling. When he spoke to the receptionist, what was his feeling? Here also they are asking, what was his feeling? Okay, is he determined to start sports from tomorrow or today now, after the knee operation? Does it happen normally? Who is just had a knee operation?
No, Father.
Question stem says, surgeon talking to a patient who is just had a knee operation. No, he says, patient says, no, I'm going to have my sport. I have no time to speak to you, doctor. Normally not possible, right? So from your general sense, you can eliminate if you want. Let's check later whether we are right. Impressed how little time he spent in the hospital. Surprised that he will be relatively pain-free soon. Let's listen. Okay. First one was sounding very upset, so we eliminated it. Let's check.
How are you feeling, Mr. Shaw?
Oh, exhausted. But the painkillers must be working. I can't feel my knee as you predicted.
You're bound to feel weary after an operation. It went well, though. We cleaned out loose cartilage from the joint. You can go home now.
Oh, thanks. I had an arthroscopy on the other knee several years ago, so I know what it's like. The idea that it gets done in less than a day is still pretty mind-boggling, though.
You'll need crutches for 2 weeks, but you should be walking okay within a month.
Oh, good.
Give it 4 months before you put any serious impact on it, though.
4 months? After my last op, I started running again within a month. Thinking about it, though, I guess I paid for it. That knee had a lot of niggles for months afterwards.
Yeah, if your body's hurting, it's telling you something.
Okay.
What is the answer?
B, Father.
B.
Okay, B. Let's check. So B, impressed by how little time he spent in the hospital. Okay, let's listen. read and write. Multitasking. This you have to do with every extract. Okay. This is the most important practice you require. Otherwise, you stumble during the exam.
How are you feeling, Mr. Shaw?
Oh, exhausted. But the painkillers must be working. I can't feel my knee as you predicted.
You're bound to feel weary after an operation. It went well, though. We cleaned out loose cartilage from the joint. You can go home now.
Oh, thanks. I had an arthroscopy on the other knee several years ago, so I know what it's like. The idea that it gets done in less than a day is still pretty mind-boggling, though.
You'll need crutches for 2 weeks, but you should be walking okay within a month.
Oh, good.
Give it 4 months before you put any serious impact on it, though.
4 months? After my last op, I started running again within a month. Thinking about it, though, I guess I paid for it. That knee had a lot of niggles for months afterwards.
Yeah, if your body's hurting, it's telling you something.
Okay.
Okay. So you got it right?
Father.
She started doing sport quickly. Impossible. You said you eliminated because you said impossible. And just had a surgery. And surprised that he will be relatively pain-free. So no, 4 months, they said. My goodness, 4 months I have to wait. Then he says, last time when I had surgery, after a month I started to jump and play sports, and I had to pay for it. After a long time, 4 years together, I had pain in my knees. So surprised, he is not surprised that he will be relatively pain soon. He said, the doctor said 4 months. It's not relatively soon. Okay. That's it. The beauty of it. If you have any queries, you can ask me now fast. And you see, if there are not sufficient people, we have reduced the sessions from weekly 3 to 1. Even this one we will be reducing, because if there aren't sufficient people, we will go only with the Zoom. So see, as of now, we don't have. Yeah.
Father, could you please repeat question number 29?
29. Yes. 29, this one. Yes. You hear a surgeon talking to a group of medical students about patient risk in emergency surgery. The surgeon is emphasizing the fact. What he is speaking to a group of medical students. Surgeon is speaking to a medical student. What does he stress? Okay. Now, prompt preparation is the most effective way to minimize patient risk. Patient risk is the common topic here. He is speaking about patient risk to the medical students. And options B is certain types of surgery carry more risk for patients than others. Patients than others. There's a problem, grammatical problem. I told you out of 7 elimination skills, one is if you have a problem. Okay, more risk for patients than others. Others means patients' relatives or patients' friends. Okay, don't worry. I don't want to take you to that deep. C, patients at high risk require extra recovery time after surgery. Now, what are they saying? If you look at the risks of elective surgery, they are really low. They are really low. Certain types of surgery, option B says certain types of surgery carry more risk for patients than others. Here it says the risk is very low. Our mortality outcomes here are actually below average, which means this is opposite, right? Option B is opposite of what is given in the audio. Then patients at high risk require extra recovery time after surgery. Do they speak anything about recovery surgery? They don't speak anything in this audio about recovery time. It's not given. It's not given at all. Then you have only one option. We'll have to ask OET people to keep at least 5-6 options so that we can have some confusion. Okay. This is crystal clear. Okay, cool. Anything else? If not, I'll stop sharing. These are the answers. Okay. So that's it. Yeah. Today Tabitha is not feeling well. Yes.
Yes, Father.
Come on, any concerns at YouTube? Yeah, let's read the comments. Please let us like the video. Yes, Modupe Noah Chinshe's father is doing a great job. Please like the video so that we reach out to many people who are really struggling. Okay, the more you like and subscribe and share, we reach out to many people so that the efforts of so many volunteers, admins here, so many of the nurses here will be useful for many people. Thank you so much, Father. It was a very good session. And next time you have to share the link the earliest and see that people reach. Otherwise, with the next session, we'll be stopping these lives. Okay, because we don't have sufficient viewers. We started with around 1,900 plus. Now we have not even 100 concurrent viewers, which says we don't require